Hello, class. My name is Lisa Henderson, and I have the opportunity to work at St. Joseph's Health in Syracuse, New York. I have the privilege of working as a centralized clinical educator in our Education Services Department, specifically supporting new hire orientation and onboarding, our medical, cardiac, and neuro unit resource pool, and working on quality improvement projects. This is my analysis of technology at St. Joseph's Health. The informatics nurse we interviewed was part of the initial Epic implementation team. She discussed what a great lift it was to onboard an entire electronic health system. There were many clinical staff pulled in as they built the system to meet the needs of the organization. As an RN in her role, she served the medical surgical units as a liaison between clinical staff and the technology staff. She also did face-to-face evaluations of workflow processes involving electronic health documentation and facilitated necessary changes within our Epic system. And she also provided clinical insight to the build teams. Our privacy officer was relatively new to her role. However, she had prior integrity and compliance experience. She was very passionate about her work, discussing how important it was, and it was everyone's responsibility to be vigilant in the healthcare data safety. She discussed how our current security system has several proactive layers, and there are continual evaluations occurring, doing deep searches for any possible breaches. She also discussed how important it was for everyone to speak up and report any incidents as soon as possible. Education is one of our greatest defenses in security and privacy. Often, staff don't even realize how personal information can be shared, and she offered specific examples and clear ways to avoid getting into these types of situations. The informatics leader interviewed assisted with new technology applications and their implementations. He discussed the process of introducing new technology within our organization. Once approved through the Finance Steering Committee, there was a cost workflow analysis completed. Being part of a larger network, Trinity Health, simplified the process to a degree. Any new application was first compared to the standard application list of Trinity. If it was already on the list, the process went much quicker. For new applications not on the list, there was a budget process which took significantly longer and was much more difficult to obtain approval. Once approval was attained, we could acquire the technology, and then the IT team began to work with clinical staff on implementation, and then evaluation. His main focus on implementation was facilitating the purpose and indication of the application with end-user expectations. The entire process takes about 6 to 8 months. He emphasized the ongoing evaluation once implemented to ensure desired outcomes and mitigate any risks which may have been encountered. Now let's take a look at the representation of technology currently being used at St. Joe's Health. There are monitor systems such as GE, telemetry, human resources technology such as Workday, ServiceNow, and Kronos, medication safety systems such as Alaris, Smart Pumps, and AcuDose and Pyxis, healthcare provider communication systems such as Epic, ClickSoft, and Cisco phones, patient care testing systems such as Preview Plus, Bravo Reflux, DaVinci Robot, 3CG Tip Confirmation, Sunquest, and many others. Technology, as you can see, is considerably integrated within our care delivery system at St. Joseph's Health. When first bringing electronic health records to St. Joseph's, there were two main systems our organization narrowed down the search to, Cerner and Epic. The pros of Cerner included its user-friendly platform and features that included education and care planning. However, Epic was more logistical. The one we ended up choosing was Epic. It was selected because it was one system capable of all of our house-wide needs, including mother-baby, the emergency department, operating room, inpatient, billing, and health information management. There is a Care Everywhere feature which allows us to connect with other Epic organizations as well as which was beneficial, because there were other local organizations utilizing Epic. Epic was also less expensive, however we did have to purchase separate learning systems. For staff education, we selected HealthStreams. This education system is dedicated to improving patient outcomes through the development of people, which is an organization's greatest asset. The system helps organizations strengthen the revenue cycle, improve care transitions, increase retention, reduce risk, plan for leadership succession, and be more compliant. It also has tracking features for completed education and certifications. We selected CRAMES to provide standardized patient education accessible through Epic for our patients. For care plans, we contracted with Provation. Epic also has portal availability, allowing patients to access their own records, which provided sharing of information through patients' care from pre-admission testing, pulling forward to day of procedures through inpatient care to discharge. The Epic implementation team was created in January 2013, and our go-live date with Epic was May 2014. Epic facilitates nursing care with documentation, best practice alerts, task reminders organizing care, and easy communication methods. Documentation is streamlined with scripting and prompts to standardize documentation. Having consistent methods of documentation with standardized verbiage allows a generation of reports for evaluation of care provided and quick results on quality improvement projects. Best practice alerts gather data entered into Epic, ensuring patient safety and evidence-based recommendations are considered and implemented. Task reminders help organize nursing care assisting with accurate, timely delivery of care. Epic has several ways of communication built in, from instant messages to pharmacy on medication needs to interprofessional plans of care, which create a comprehensive picture of the patient's progress. Our patient portal makes it easy for patients to access medical information, schedule request appointments, and communicate with their caregivers. Information available includes medical history, medications, and treatment records for visits within the St. Joseph's Health system. From May 1st, 2014 forward. With My St. Joseph's portal, patients can communicate with their physician if they are affiliated with one of our primary care centers or hospital clinics. Epic helps with care transitions across the whole network, recording the story of a patient's healthcare over time. Some of the advantages include the logistic nature, which facilitates data collection and analysis. There isn't a lot of free texting into Epic, so much of the care offered is standardized. Other local organizations use this system, which allows us to share data. An Epic system design allows us to get the patient care bill out the door faster to improve financial flow. Some of the disadvantages include malware can shut down the one system. Having all of our information in one area allows cybersecurity breach to be our biggest risk. There are no consistent narratives in Epic, making chart reviews sometimes cumbersome and difficult to obtain non-quantifiable data. Our organization has chosen to demonstrate our commitment to transparency and continuous improvement through participation in the Leapfrog Hospital Survey. The Leapfrog Hospital Survey results can tell you a lot about a hospital and if it provides safe, high-quality care. Back in 2015, our Leapfrog Hospital grade was a C. In spring 2018, we achieved a Leapfrog Hospital grade of A. This is one way to see how electronic health records has helped us provide safe, quality care and improvement. Electronic health record incentive programs have worked from the perspective that the use of electronic health records has increased greatly in the past several years. Accountability of caregivers' role in healthcare outcomes has improved. Further work still needs to be done regarding data accuracy, analysis, and meaningful use, connecting all healthcare platforms seamlessly for patient care. At our organization, there are several ways we ensure privacy. Administratively, there are policy and procedures which guide and protect staff regarding HIPAA and protecting personal health information. Education for leadership and all frontline staff keep everyone informed on their responsibilities regarding privacy. There are physical safeguards such as locked doors and strategic setup of care delivery, for example, triage areas separated to prevent accidental sharing of personal health information, and our home care nurses have all their laptops which must remain locked with dual password sign-ons. There are also technical safeguards with proactive cybersecurity. We conduct ongoing risk assessments looking at emergency cyber threat responses, physical risks to our own buildings, servers, and hardware, and points of entry. Ongoing audits are also performed, random phishing emails are sent, personal tests for data break entry points, and quarterly system-wide audits. These reveal any potential vulnerable areas which may need further security or staff who may need education reinforcement. Finally, our network is set up with a secure design to divert anything suspicious. Our closed network servers are protected physically and electronically. There's a program which shows everything running in the background and can isolate repeating codes representing potential viruses. Let's take a closer look at 4 technological innovations currently in place at St. Joseph's Health, which impact nursing delivery of care and patient outcomes. First, the Guardrails medication safety software used in conjunction with our Alaris Smart infusion pumps. This technology is designed to reduce the number of medication errors that reach the patient by allowing the hospital to configure best practice administration parameters for IV infusions for varied units. This can minimize programming errors contributing to the risk of patient harm. Our pharmacy creates a comprehensive drug library, which is critical for the effective and safe use of our Alaris Smart Infusion pumps. Another example is a Sherlock 3CG tip confirmation system. PICC placement confirmation used to only be by chest x-ray. This technology is indicated for use as an alternative to chest x-ray and fluoroscopy for PICC tip placement confirmation in adult patients, allowing for vet nurses to place PICCs at the bedside without the need for portable chest x-rays. It provides an accurate way to confirm PICC placement without exposing our patient to an additional test and radiation. Another example is the Bravo calibration-free reflux testing system. Gastroesophageal reflux, or GERD, can be painful and can damage the esophagus lining. The Bravo reflux testing system is an innovative solution that allows physicians to evaluate the frequency and duration of acid reflux in order to better understand patient symptoms. With up to a 96-hour monitoring period, the Bravo reflux testing system increases the likelihood of detecting reflux events with improved symptom association determination. The catheter-free design is better tolerated by patients and allows physicians to document relationships between symptoms and acid reflux events. Finally, ClickSoft is another example. With the emergence of smartphones, communication from nurses to healthcare providers inevitably progresses to texting. To ensure patient privacy is secure, healthcare providers must have a secure way of communicating. ClickSoft closes the communication loop by using secure texting to communicate patient information in a HIPAA-compliant manner. Doctors and nurses can use Click on their smartphones as well as on a desktop computer. One key element to improve clinical outcomes is care team collaboration. From pre-admission to post-discharge, secure texting allows for safe, quick, and effective communication between care team members. In our organization, we specifically utilize this app to transmit 12-lead EKGs to our interventional cardiologists for patients suspected to be suffering from an acute MI. Time is of the essence, and this app allows us to securely transmit data as necessary to quickly assemble the cardio team in an efficient manner. In summary, electronic health records have standardized documentation and provide a vast storehouse of data which can be utilized to promote evidence-based nursing practice. Now that we have all the data, interoperability and data sharing are focus areas to help translate analysis into accurate, comprehensive, meaningful data. Technology has brought in many improvements and expanded options and opportunities for patient care delivery. However, along with this, there are risks and security issues which healthcare providers are responsible for. We must always be anticipating and proactively searching for ways to protect our patients' personal health information. There are always new and improved technologies to improve patient experience, decrease adverse risks, and promote patient safety. Selecting, validating, and implementing and evaluating these applications are processes which need to be clearly defined and followed for safe implementation of new technology for patient care. Technology has brought interdisciplinary team collaboration to a new level. Communication methods are faster and easier with rapid responses. Healthcare team members will need to continue to find ways to work together to care for the increased acuity and complexity of their patients. It takes a team to offer comprehensive care as technology continues to open more options and treatments available. Informatics in healthcare is a much broader scope than I had originally envisioned. It is amazing to look through a different lens at how technology has impacted our everyday life and the way we delivered healthcare. From electronic health records to scheduling diagnostic tests to communicating with other providers, technology has integrated itself into our care delivery model in every way. While it's incredible to think of all that we can do with advanced technology and big databases of knowledge, it was also eye-opening to hear how vulnerable our systems can be without proper precautions. Having all of our data in one storehouse is a wonderful opportunity to research and validate evidence-based practice, but also can create massive security issues with one data breach. Informatics is gaining ground as we become more reliable upon technology and databases. Present and future nurse administrators will need to have comprehensive understanding on meaningful uses and threats of data to anticipate how healthcare will evolve so frontline staff can continue to provide the quality patient care needed using every advantage of technology and be agile enough to sidestep or prevent as many disadvantages as possible. Nurse leaders will need to be well informed on the uses and applications of technology within healthcare. Thank you.